This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, it's Jeff Ratliff with Thomas Jefferson University and the Neurology Podcast. On today's episode of the Neurology Podcast, I'm here with Jacob Stubbs, a medical student at the University of British Columbia, and Michael Fox, the director of the Center for Brain Circuit Therapeutics at Brigham and Women's Hospital. Jacob and Michael are first and senior authors, respectively, on a paper published in Nature Mental Health on September 25th of this year, titled Heterogeneous Neuroimaging Findings Across Substance Use Disorders Localized to a Common Brain Network. Podcast listeners will recognize Michael Fox as a prior guest on the podcast, discussing his ongoing work in exploring how brain network connectivity mapping can help explain a number of neurologic and psychiatric syndromes. We've discussed brain networks in cervical dystonia, as well as cognitive impairment following deep brain stimulation in Parkinson's. In this study, Jacob, Michael, and their colleagues sought to explore brain network associations across cases with substance use disorder. Guys, welcome to the podcast.
Yeah, thank you so much for having me back, Jeff. Good to see you.
Thank you.
So, Jacob, I want to start with you. And before we delve into some of the details of what kind of research subjects informed your results, can you summarize for us what you and your colleagues learned about brain networks associated with substance use in this study?
So to start with a little bit of context, there's been decades worth of studies that have used brain imaging to look at what sort of brain abnormalities are associated with substance use disorder and addiction. But when we look at the results of all of these previous studies, we find that almost every brain region has been implicated in one way or another. So how we make sense of this, and perhaps more importantly, where we could try and target therapeutically, has remained unclear. And so in this study, we used an approach called network mapping, which uses a functional connectome, or what we can think of as an average wiring diagram of the human brain, to show that neuroimaging abnormalities in substance use disorders are linked to a common brain network. We found that this brain network was similar across different substances of use, and similar across different imaging modalities. We also found that brain lesions that disrupt addiction intersect specific areas of this network. Overall, our work uses data from decades worth of brain imaging studies along with lesion data to suggest that there is a common brain network in substance use disorders and addiction.
And so, Michael, I know in prior studies using that methodology, your brain network findings have been informed by cases reported in the literature with syndromes following structural brain lesions. And in this study, the neuroimaging data from subjects seemed to be more variable from that. And so my understanding is that some of this data was based on brain atrophy patterns in subjects with substance use. And then subsequent testing looked at neuroimaging of subjects who had resolution of specifically nicotine use disorder following brain lesions. Is that correct? Can you explain a little bit more about the cohort of subjects that were used to find these associations and what type of neuroimaging data was helpful here?
Yeah, Jeff, you're exactly right. A lot of the motivation for this network mapping approach that Jacob referred to came from studies of brain lesions. And across a lot of different neurological or psychiatric symptoms, if you look at case reports where a lesion caused a specific neurological or psychiatric effect, and you look at where those lesions are located, more often than not, the lesions don't intersect one specific brain region. They occur in lots of different brain locations. And so we use the connectome that Jacob referred to, a wiring diagram of the human brain, to make sense of these different lesions in different locations that cause a common neurological or psychiatric symptom. And that's what we've called lesion network mapping, testing what brain network do the lesions map to that cause a specific behavioral effect. In Jacob's paper, we took that same lesion network mapping approach, but applied it to neuroimaging coordinates of brain atrophy. The logic was if lesions that cause the same effect don't map onto one brain region, but instead map onto a connected brain network, then maybe the same thing holds true for neuroimaging abnormalities or neuroimaging coordinates. So what Jacob did is looked at the coordinates of brain atrophy in lots of different neuroimaging studies and said, okay, these coordinates of brain atrophy across different substances of abuse, across different studies in addiction, map onto lots of different brain regions. Are these coordinates all part of one connected brain network? Moving from lesion network mapping to a new technique that we call coordinate network mapping.
Okay, so from both of you, we've heard about the principles of the functional connectivity mapping and this average wiring diagram that Jacob talked about. And Mike built upon that with this network coordination mapping. So using those methods, Jacob, can you tell us about with patients with substance use disorder, what are the components of that brain network that this study helped us learn more about or that you guys uncovered?
We found 144 different studies, and we used this network mapping approach to derive essentially a single, relatively sensitive and relatively specific brain network. And the core components of this brain network included the anterior cingulate, the insula, the dorsolateral prefrontal cortex, the thalamus, and those were what we consider positive nodes of the network. There was also some negative nodes of the network that included the medial prefrontal cortex and the occipital cortex.
Okay, so in building on that, as we're looking at brain networks associated with substance use disorder based on the brain atrophy and the fMRI data, but you mentioned there's positive nodes and negative nodes. So in that context, can you help teach us what's a positive node, what's a negative node in this broader context of functional connectivity mapping when we're talking about learning more about these neuropsychiatric syndromes?
The brain network that we identified has both positive and negative nodes. At a really high level, positive nodes are the areas of the network that have a pattern of blood flow called a bold signal. It's very similar to the bold signal that we would find in regions of atrophy and substance use disorder. The negative nodes of the network are the opposite. So they have a bold signal that is opposite to the bold signal that we would find in regions of atrophy in substance use disorder. So to be clear, both the positive and negative nodes represent connectivity to this common brain network, but just with potentially opposite implications. So to test whether damage to this network was associated with the disruption of addiction, we used lesion data from patients whose addiction to nicotine went away after they had a stroke. And what we found was that lesions that cause addiction to go away preferentially intersect the positive nodes of this brain network.
I'll add on the coordinates of brain atrophy in studies of different substances of abuse are going to fall within the positive nodes of the network. So if you take any neuroimaging study of patients with addiction and look at where their atrophy is, that's more likely to fall in the positive nodes of the network. They're going to have atrophy in the anterior cingulate and the insula. The atrophy is extremely unlikely to occur in the negative nodes of the network, like the medial prefrontal cortex.
To build on that, you talked about validating or further refining this network based on looking at these lesions that cause substance use remission in patients with nicotine use disorder. When we've spoken in the past about brain networks helping us learn about neurologic syndromes, I've kind of forced you to speculate a little bit about therapeutic implications. And so I don't have to explain to everyone that medical interventions or surgical interventions that could cure nicotine or substance use disorder obviously would have huge medical benefits and ramifications. Beyond just smoking, we're in the midst of an opioid addiction epidemic in the United States. I mean, there's a lot of people who would love to see therapeutic interventions in this realm. And so maybe I'm getting too far ahead of myself here, but just to ask, what do the results of this project potentially inform us about using either targeted brain stimulation or targeted lesioning or other interventions to potentially treat substance use disorders and addiction disorders down the road?
Step one of that question is how we interpret these atrophy locations in patients with substance use disorder. Because even though Jacob was able to show that these locations of atrophy all localized to a common brain network, we don't know how to interpret that brain network. Is it causing addiction? Is it predisposing to addiction? Is it compensating for addiction? So just these neuroimaging correlates, they don't get us to a treatment target because we don't know how to interpret the neuroimaging findings. And that's where Jacob brought in the brain lesions that have a causal effect on addiction. And so he was able to test whether or not lesions that hit this network make addiction worse, make addiction better, or are unrelated to addiction. And what he found was actually very surprising, which is these locations of atrophy map to exactly the same network, that a lesion to that network will actually improve addiction. Now, that's not what you would expect if the atrophy was causing or predisposing to addiction. You'd expect that a lesion would make things even worse. It's not. It actually made the addiction better. So it really challenges the way that we've been interpreting neuroimaging abnormalities in patients with addiction. But the lesions actually provide that causal missing link between these neuroimaging abnormalities and how we might design a neuromodulation treatment. And in fact, it's the opposite of what a lot of people might have assumed.
And so, Jacob, I think the tough question then comes to you, and that Michael just described some of these paradoxes in the findings that lesions and atrophic nodes in this network, maybe on first glance, doesn't seem to sort of line up in the way that we might expect. And so my question for you is, what do we do next? What kind of projects or follow-up research are going to allow us to build on what you found here to potentially maybe get us closer to beyond an association, but actually finding some more in-depth causality in this network that may inform clinical or therapeutic implications down the road?
I think there's a few strategies. So first, I think a really straightforward step could be to look at previous neurostimulation trials in substance use disorders and just see if the regions that they targeted align with our network. It'd be, I think, really interesting to see if more effective clinical trial targets are more closely aligned with this brain network that we found. Second, I think a real limitation to our study was that it primarily focused on group level patterns of atrophy. So replicating this network using individual level data might give us a more detailed and nuanced picture and understanding of the brain networks that are linked to addiction. And finally, I think this study, obviously in conjunction with other research in the field, gives us a brain network to try and target therapeutically rather than a single brain region. And so our results may be used to justify where neurostimulation studies or clinical trials could target in order to try and improve treatment for substance use disorders.
Thank you. And I think this is a really interesting and exciting first step as we're trying to learn more about what's going on in these more complex neuropsychiatric syndromes. So with that, I will wrap up. And I want to thank you both for joining us. Again, I've been speaking with Jacob Stubbs from the University of British Columbia and Michael Fox from Brigham and Women's Hospital in Boston about their paper from Nature Mental Health titled Heterogeneous Neuroimaging Findings Across Substance Use Disorders Localized to a Common Brain Network. Thanks again.
Thanks, Jeff.
Yeah, thank you, Jeff.
Thanks for listening to the Neurology Podcast. We'll see you next time.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.